So I'm pleased to report over the last 20 years there's been a dramatic change in the treatment of multiple sclerosis. 20 years ago when I was training there were no treatments, but now there are many treatments to reduce the number of attacks that people have with relapsing remitting multiple sclerosis. It's quite a complicated area, and there are now up to 14 or 15 licensed treatments. And the way I like to think of it is there are three main categories of treatments. These are the original injectable treatments called beta interferons that reduce the relapse rate by about a third. Then there are the newer tablet treatments, such as Tecfidera, that reduce the number of attacks by about 50%. And then we have the stronger monoclonal antibody treatments, such as Lemtrada, that can reduce the attack rate by about 75%, with many more. The question you might ask is why isn't everyone on the stronger treatments? And the main reasons for this is there's a lot of discussion to be had with the doctor and the person with multiple sclerosis about how much effect they want versus the side effects. And with the stronger treatments, there can be rarer but serious side effects. So it's quite a complicated and detailed and specific discussion that is required for each particular person with multiple sclerosis. So that's relapsing remitting multiple sclerosis. For progressive multiple sclerosis, unfortunately, the options are much more limited, though in the next year or so there may be some emerging treatments. I think it's also to mention it's worth taking part in clinical trials, and the UK MS Society always has a list of ongoing clinical trials. Apart from the disease-modifying treatment, we must not forget in whichever stage of multiple sclerosis the person is, there are many symptomatic treatments. For example, to control bladder problems, nerve pain, and stiffness. And also I'd very much encourage the use of neurological physiotherapy. I think that's a vital part of the treatment plan. Also, when a person has a relapse, so an attack as it were, then we use high-dose steroids to damp that down.